microphone and state your name and address. Well, I guess your business address would be fine.
Okay, my name is Annie Wiesner. I'm the Director of Grants for Avicenna Community Health Center. And I actually don't know our clinic address off the top of my head. I can give you my home address if that's all right.
That'd be fine.
It's 1201 Philo Road in Urbana. And I do have, if you all would like, some handouts that I'm happy to share.
Okay.
Wonderful. It's very basic information. So I also did bring some members of our board of directors with me here today to answer any questions afterwards if you all would like. So like I said, I'm the director of grants for Avicenna, and Avicenna is Champaign-Urbana's currently only completely free community health clinic. And we offer our patients a combination of preventative and curative healthcare services, so they can come to us for both acute and chronic illnesses and see our team of volunteer physicians. And they also have the chance to meet with a nutritionist and a registered dietitian every time they come to the clinic. So this gives us a chance both to address critical care needs and to address long-term preventative care. We've been open since 2009, and since then we've offered over $400,000 in free healthcare services to over 2,300 members of Champaign-Urbana, and most of those were within the last year alone, so our patient base is growing. And we do this primarily through our main clinic, which is located at the Francis Nelson Community Health Center on Bloomington Road. We operate there on Sundays from 1 to 4 p.m., and we also do a number of outreach events, and our primary outreach is through the Daily Bread Soup Kitchen. We're there every other Wednesday to offer basic health assessments there as well. And we recently began collecting income data on our patients, and from that we estimate that about 3/4 of our patients actually fall into the extremely low income category, and the remaining quarter fall into the low income category, and less than 1% fall into the moderate or high income category. And so we believe that by offering these members of our community that are most in need the chance for free healthcare services, we're really able to contribute to the community both directly by improving their health, by allowing them these services they couldn't otherwise access, and also indirectly by freeing up these funds for other things such as food, housing, and education. So to this end, we've requested help with 3 of our initiatives for this upcoming year. The first is an expansion of our current clinic hours. As I mentioned, we're open Sundays 1 to 4, and we would like to expand to Thursday evenings 6 to 8 p.m. as well. We have the space. Francis Nelson has given us the space that evening. We have the volunteers necessary to staff the clinic. What we need are the funds to pay for things like rent, utilities, and one of our biggest expenses, which is labs for our patients. We're also requesting help in hiring a part-time clinic director who would manage the expansion of the clinic as well as some of these outreach events that I mentioned. Our second initiative is to extend our outreach to the homeless community in Champaign-Urbana. And we currently, as I mentioned, work with the Daily Bread Soup Kitchen, and we just started an initiative to also work with the Time Center, which is a transitional living facility for men in Champaign County. And we're very limited in the type of care we're able to offer at these events because we cannot access our electronic medical records when we're off-site. So we're requesting the funds to pay for 6 tablets that would allow us to use our electronic medical records system to track these patients at Daily Bread Soup Kitchen and at the Time Center. There are a lot of barriers to these patients making it to our main clinic, so this allows us to actually look at their past health care, see if they've had any changes in their health status that might be important for their future health. The third initiative that we're very excited about is actually new this spring. We recently secured donations of pharmaceuticals from a group called Direct Relief. They donate these drugs to us, and we're able to disperse them to our patients completely free of charge. And these are the medications that our patients are most in need of. However, the amount of time and training that is required to appropriately process the donations, label the medications, and get them to our patients exceeds what our volunteer staff is able to provide. So to that end, we're requesting funds for a part-time pharmacy director who would be in charge of managing these donations and getting them out to our patients. And this is one of the number one concerns we encounter with our patients who cannot afford health care and are coming to us for that reason, is that they're worried they can't afford the medications they need for their long-term health. So we believe these 3 initiatives together will really address some of the goals of the Consolidated Services Funding, and that in particular we'll be able to address accessibility to health care, accessibility to prescriptions, and services to our homeless population. And this is Dr. Pavan Aujla, one of our clinic operation directors and one of our members of our board of directors here to help me answer some questions as well. Thank you all so much.
Okay. You pay rent to Francis Nelson, is that correct?
Yes. You want to share?
Yes, we pay rent to Francis Nelson Health Center. That includes utilities and the square footage of the exam rooms and our office space. It's one of our major costs.
And the people that you serve are not eligible for Medicaid?
Correct, yes. They're uninsured.
Why would someone be ineligible for Medicaid?
So there are some populations of people, including undocumented immigrants. So there's a migrant worker population in Rantoul, Illinois. There's a good example of folks that are not eligible for the Affordable Care Act, and they would be some of our population at this point. But we also see, for example, there are students who are coming, who are international students who are not yet eligible for university insurance, and they are also uninsured. So we see a few of those people.
We also see some patients who are ineligible for Medicaid and have opted to either still are currently uninsured or have opted to pay the fine rather than pay for private insurance because they don't feel they can afford the cost of private insurance.
Any questions? Dennis?
And so when you're working at the Time Center, you indicated that you wanted to have these tablets so you could access your files. Do you have to pay a rent there as well? Do you have any kind of overhead? And how do you set up your office? Are you just at a card table, or what are you doing there?
So we actually just initiated this partnership with the Time Center, so the details of our interactions with them are still going to be worked out, but there will be no overhead. We're there as a volunteer organization operating under their roof. They've invited us to come be able to see their population. Can you speak to that?
Yeah, we do run a similar operation at the Daily Bread Soup Kitchen. I don't know if you're familiar with that location, and we'd be doing the same thing there. So they have a resource center, which is a room that's available to volunteer groups. So it's like a card table, but folks are used to coming into this little office, and we're able to do blood pressure screening and cholesterol screening. And so it's great because people who really wouldn't normally get access to health care are able to get checked out and get screened, and then we're able to use our electronic medical record to make appointments in real time. So we can use our computers to sign patients up and give them a slot to come in and show them how to get to the clinic and things like that.
So really it acts as a place where you can meet these people and then direct them to your clinic so you can actually do real work on them.
Right, exactly.
A real evaluation.
And then we become the primary care providers for these people who are homeless and don't otherwise have access to care. So oftentimes they end up in the emergency department, to be honest, and with really high blood glucose, and sometimes we catch it. I've been there when we check their blood, and the blood glucose is very high, and they should be going to the emergency department, and we're able to intervene and make an appointment for them and provide follow-up care.
So part of the issue is that for many of our patients, you need to be able to compare to a past reading in order to say, so for one person, a blood pressure of 140 over 180 might be normal. For another person, it might be very high. But if we can't look at, especially our homeless population, we don't get to see them regularly. They have a hard time getting to the clinic. So if we can't access their past records, we have no way of saying, wow, your blood pressure's shot up. You really need to look into this versus, well, this is just a high normal reading.
Right, so we're also able to, I forgot to mention that, which just reminded me, we're able to put in those values into our electronic medical record system. So we have all their vital signs from all previous visits, so it's a good point.
Carol Ammons?
I just wanted to clarify, you said your population is homeless people primarily, and they don't qualify because of the homeless status for Medicaid?
So I think there's a lot of confusion about what the Affordable Care Act is actually meaning for people. So people still have to pay a copay, and a lot of people can't afford the copay.
Right.
A lot of our patients cannot even afford the discounted medication, which is $4 a month or something like that. It's difficult for them to be able to do that for themselves and their family. So,
and then just the follow up on, not from that question, but second question would be, are there once you collect the income information, are some people disqualified from using Abyssinia?
No, there's absolutely no requirement, no income requirement at all. It's purely for our information so we can see what our population is like and what their needs are.
And then how do you fund the clinic currently?
It's primarily through private donations. We've had some very generous donors who helped us get up and running, who have continued to support us. And now that we've been established now for almost 5 years, we're hoping to gain more momentum on the grants end.
All right, thank you.
Eric Jacobson?
So you said that You quoted a figure of $400,000 as the amount of free health care that you've provided over the past 5 years. Is that?
Yes,
is that
that's
right?
correct.
And how do you price that out? Do you compare what you do to what it would cost at an ordinary place, or how do you do that?
Sure. So part of it is direct cost. As I mentioned, labs are one of our most expensive costs, and we actually get our labs severely discounted through one of our partner organizations, but those still cost about $20 per lab, and we cover those completely. Our patients pay none of that. So part of that is a direct cost that we can just say how much of our expenses directly went towards serving our patients. We also look at average copay in the area. So we're not looking at, when we say $400,000, we're not saying that would be $400,000 that an insurance company would have been billed. We're saying that's $400,000 that our patients would have collectively spent elsewhere had we not been in existence. So it's a combination of copay cost, what it would cost for a patient to receive a lab, and what we've paid for that, and then some of the free medications that we're able to provide.
And how many patients is that?
2,300 overall, but it's been ramping up. So we see approximately 16 patients a week at our main clinic, and then additional patients through our outreach events.
It's 2,300 since 2009.
Yes, that's correct.
What is it annually?
In the past year, it was actually 1,300, including those we saw at our outreach events.
Okay, thank you. Diane?
Do you partner with any local healthcare institutions?
Yeah, we partner with many. Do you want to speak
Yeah,
to?
so we obviously are renting from Francis Nelson Health Center, and one really great thing, that relationship we have with them, is that we have referral slots. So on Tuesday and Thursday, we're able to refer our patients that we see on Sunday to Francis Nelson. So we have 2 slots per week. And this is huge because a lot of issues we can't do. So patients may need x-rays or further tests that we can't do at our clinic. If they were to go to Francis Nelson, to the door of Francis Nelson, and sign up, the wait list would be from anywhere from 3 to 9 months. But because of this relationship we have with the clinic, we're able to directly refer our patients that week. So we use our best judgment to, on Sunday, decide which 2 patients out of the 16 to 20 that we have seen should be referred to Francis Nelson, and then they can go 2 days later versus months later. And we also work with all of the, so there's another free clinic that is at Provena at Presence, Champaign County Christian Health Center, and they're primarily the other healthcare location that are free clinics, but they also charge a copay to patients. So we're really the only absolutely free clinic in Champaign-Urbana.
Any other questions? Diane?
So the reason they don't go directly to Francis Nelson is because they can't afford Francis Nelson.
It's primarily the wait time. It's going to be 3 to 9 months for them to be able to get an appointment directly at Francis Nelson, but also Francis Nelson does charge copays. So it's a combination of both. For some of our patients, the copay is cost prohibitive, and for some of them, their issues are more urgent. And so they just need to be able to see someone within the month, for example, as opposed to 6 to 9 months later.
Have you approached any of the large institutions like Carle Hospital, for example?
Yes. Yes, we have. We've asked Carl to help us with our rent as well, but we haven't had any success in receiving donations from Carl.
And we currently are working on a grant through the Faith 2 grant, which is part of Presence or Provena, and have been closely communicating with Paul Donahue, who's their vice president, with regards to a relationship with them. So we're hopeful that we can build up some of these partnerships building into this year.
Does Carle have an application process for charity care?
Yeah, they have a community care program, I believe it's called. But again, it's a discount. So if you cut your finger and you go to the emergency department, I'm sure you know it costs something like $400 a stitch or something it costs at this point. So say somebody gets a bill for $6,000 and they go to the emergency department, they may get a discount through the community care program for about $3,000, but they still owe $3,000 to Carl. So.
And there's also about a 2-month wait to be considered for that.
I meant, is there a process that they have for an agency like yourselves to ask them for help?
They have individual grant opportunities that they'll release, and so the process is slightly different for each of those, but it's pretty standard. There's frequently a letter of intent. Sometimes there's no preliminary screening process, but it's dependent on the specific funding source. It's not a standardized process.
They don't just do their own charity care?
They do, and so some of their charitable giving is is kind of more grant-based in terms of it's a formal application. Most of the charitable giving requires a kind of formal application to be considered for support.
Well, have you done that?
Yes, we have, and we are planning to continue to do it. One of the primary things that we get told, that we have been told in the past, is that we're a new clinic and that we don't have a history of grant funding. So it's kind of a catch-22 because we're told, well, we're not willing to fund you because no one else has yet been willing to fund you. We need grants to get grants. So we are hoping that someone will look at our history of care and be willing to take that chance on us and be the first organization to be willing to fund us. But we're encouraged that kind of once we get that ball rolling, it will be much easier to get funding from these large groups because they essentially are concerned about our lack of grant funding in the past.
Okay. Any other questions? Thank you very much.
Thank you so much.
you.
Champaign County Regional Planning Commission is next.
The Champaign County Regional Planning Commission for the Youth Assessment Center. I don't see anyone from their agency, so we will go to the Junior League of Champaign-Urbana for the Junior League Bright Starts.
Hi, would you please state your name and address?
Sure. My name is Katie Madigan. I'm currently the Community Impact Council Director for the Junior League of Champaign-Urbana, and our agency address is 3358 Big Pine Trail, Suite A in Champaign. And this is Sarah Olson.
Hi.
She'll be the chair of the committee for this project next year.
Okay.
So I'll just start by telling you a little bit of background about what Junior League is. It's an organization of women volunteers that's been in Champaign-Urbana since 1932. But we also belong to the Associations of Junior League International, which is an international organization of over 260 communities. And our mission is that we are an organization of women committed to promoting volunteerism, developing the potential of women, and improving communities through the effective action and leadership of trained volunteers. So several years ago, the Junior League decided to focus our efforts on one issue that we studied in the community, and that is we decided on basic needs for school readiness. And so all of our projects that we have been working on for the last several years target this in some way. So we have the Junior League Locker, which is a place where school teachers in Champaign and Urbana can come and shop for free school supplies for their students or their classroom. We have partnered with Eastern Illinois Food Bank to start the Backpack Buddies program, which they've now grown on their own. And we've also hosted the Books by the Bushel and Head Start mentoring program, where we've donated books every year to the school libraries in the communities. So all of our issues are focused on women and children, but specifically now basic needs for school readiness. So the Junior League of Champaign-Urbana's Bright Starts program, we're going to have a pilot year next year, is going to provide monthly preschool academic instruction and social emotional skill building to children who are on the preschool waiting list at Urbana Early Childhood School. It's also going to provide their parents or guardians with some ideas to reinforce these skills at home. The program will reach children ages 3 to 5 who have not yet been able to experience the preschool environment. It will also provide supplemental parent education to reinforce what the children are learning and give parents skills to practice this at home. The need is that there's a large waiting list for most of the free preschool programs in our community. For example, Urbana Early Childhood had 149 children on their waiting list in the 2013-2014 academic year. Champaign Early Childhood has a similar number, and Head Start is often some of the same applicants, but they had a wait list of about 200 at one point, and there were also children removed from care or from service because of their funding slash. Kids who don't make it into preschool start school without some of the basic skills needed, and then their parents may be unable to provide some of these at home because they're unaware of what is normal early childhood development. There's no education programs currently in Champaign-Urbana for kids on the waiting list for these free preschool programs. And multiple community agencies have stressed the need for learning social emotional skills prior to entering kindergarten. And many of them have tried or intended to start some sort of program, but have failed to do so because of financial resources. So Junior League is going to partner with Urbana Early Childhood to identify, prioritize, and register kids and families for the Bright Starts program. We chose Urbana Early Childhood because they have a wonderful principal and a new facility that was very inviting. And they specifically built it in an area of high need for the population that they serve. The classes are going to meet once a month, September, October, November, and then also January, February, March, and April, for a total of 7 classes. And we're going to alternate the programs. One month they'll be focused on academics, the next month on social emotional concepts. And before the program starts, the families will have an opportunity to sit down for a free hot meal together. So we're going to serve them a meal and then separate the kids and the families will go and learn about what the children are learning and how they can support them. And then we're also going to invite community agencies to come in and do some parent education on what their services might entail. Like, for example, if we invited Crisis Nursery, what they can offer to these families as well. There's also going to be childcare provided to siblings who aren't in the 3 to 5 age, but who parents might need to bring along. And this is all going to be, the sibling care is going to be provided by our Junior League volunteers. And the classes are going to be taught by either teachers or paraprofessionals from Urbana Early Childhood who we will pay, and then we will be supporting them in an assistant role. The Junior League volunteers will also assist with the dinner preparation, service, and cleanup, as well as assisting with classroom setup, classroom activities, parent activities, child care, and cleanup. We've identified some areas that we would like to see if our program can grow, because many other people have been interested in something like this, but we have to start somewhere. So we chose Urbana Early Childhood to start. And what we're going to measure our program is through the number and percentage of returning families to each session, because they have the opportunity to register for one session or multiple. Parent satisfaction surveys at the end of each session, a survey at the end of the entire year, and then some ratings by kindergarten teachers in the following year of some of the skills that we covered in our sessions. So some of the benefits of our program is that children will receive exposure to kindergarten preparatory skills such as fine motor skills, letter and number identification, listening skills, peer interaction, and emotional development. And then parents will receive instruction on skill development and at-home activities, and they're going to receive materials to support what their children learn in the classroom. Both children and parents will be introduced to the classroom setting, gain exposure to kindergarten skills, get tools to continue learning and developing those skills, and strengthen the parent-child relationship. And we recently learned of an article, some research that was conducted by some of our professors here at the University of Illinois, Susan Fowler and Don Thomas, and they found that there was a drop-in preschool program in Elgin that provided like an hour of preschool activities as kids passed by. They could just kind of stop in for the preschool. And it was so popular that they had to expand from 5 to 12 locations and serve 164 children. So these programs were found to be critical in getting children into early childhood education programs later on if they couldn't be enrolled immediately. And they're helping to bridge gaps that we don't have right now. We're requesting some funds just to get us started, and those funds include things like personnel expenses, so paying the teachers that we will be asking to teach extra hours of the day, materials for the classroom, take-home materials. We're going to offer some giveaway incentives, and one other thing is transportation. We are requesting some money for transportation because we have spoken with the MTD several times, and they were less than helpful in getting us vouchers for this type of activity. So we would like to be able to purchase vouchers for some of our families if the transportation is the difficulty in them getting to a program like this.
Okay, Bill Brown.
Would you also include some kind of child care for people that have other children?
Yes, we're going to have Junior League volunteers providing the child care for siblings.
And then it seems like over the summer would be a good opportunity to reach people, plus there'd be more possibility of teacher availability as far as maybe less time constraints on teachers, and they'd have more time, might get more response from teachers. So would that just be an expansion option, or is there some obstacle to having it over the summer?
When we first proposed this, we did research two possibilities, which one was a summer week-long sort of thing, but we thought through some of our research, we found that maybe the evening we would be able to get more people to attend than during a workday activity, because it's an opportunity for parents and students and not just a drop-off for students.
But even in the evening, you aren't planning to currently offer it in the summer, right? It's just during the school year.
Not at this point, but we hope to expand eventually.
How many children on the waiting list are you going to actually cover?
I think we can serve 40 per session.
Okay, so it would be the same 40 that go all 7 times?
No, it doesn't have to be.
Okay. Any other questions? Eric.
So I just want to be sure I have this right. The people who actually deliver the education to the kids and the people who deliver the training to the parents are people with professional credentials in early childhood education who are primarily associated with the university? Is that correct?
They'll be with the Urbana Early Childhood.
Oh, Urbana Early Childhood. Okay, so they're employed, their major employer is the Urbana School District.
Yes.
Okay.
Mm-hmm. Okay, Carol?
Just to clarify, how do you intend to get their involvement, the parents and the children's involvement in the program?
The school district keeps their waiting list, and in order to protect some confidentiality, we're going to have staff at Urbana Early Childhood be the contact person for enrollment for these sessions.
And would participation help them get into the program later, or?
I think it will just be a contact avenue, so we can keep in touch with them and offer our support if they don't continue to get into the program.
Okay, thank you.
Eric.
So just to be clear, the distinct contribution of the Junior League to this is, number one, you actually do a lot of organization for it, and number two, your members provide volunteer work both for the organization and for the sibling child care.
Yes.
And okay.
Exactly.
Mike.
So let me get this straight. You're talking about 40 people on a given month, and say half of them have a ride, half don't. MTD won't pony up 20 vouchers a month?
I've spoken to them. The United Way has spoken to them on our behalf, and I think the deputy superintendent was intending to speak to them as well. And I offered an idea because it had been used in other ways. When United Way had their Ready, Set, Grow program at Lincoln Square, MTD had a voucher that people could use to travel to and from that event. And I was told that it would be too difficult to do that for more than one event. So on a continual basis, I guess.
Okay, thanks.
Anyone else? Thank you very much.
We will go back to the Champaign County Regional Planning Commission for the Youth Assessment Center.
Sorry, running late tonight.
Darlene, want to state your name and your office address, I guess.
I'm Darlene Kleppel. I'm the Director of Community Services at the Champaign County Regional Planning Commission.
1776.
1776 East Washington Street, Urbana, 61802, sorry.
Okay. You want to talk about your proposal?
Sure. The commission has made proposals to the City Council for social service funding for many years for our court diversion program, and you have funded that program at a level of somewhere between usually $4,000 and $6,000. We are asking for a little bit more money this year because the program has expanded to include not only kids that are being put on station adjustment by the police officers, but also to respond to our partners' request to also serve kids before they get in any contact with the police at all. And so we have opened up our doors to kids that are being referred from the school districts. From actually, we have some kids so far that are just walking in with their families that are saying, you know, I'm at the end of my rope and I don't know what to do, so please refer me somewhere or give me some help. If it's okay, I can distribute our statistics. Would you guys like to see those for the year to date? So these statistics will be from since July of 2013 through today. The center itself for the new services opened the 1st of October, and so those statistics are included, but it is not for the whole year. So you can see from our statistics from the various columns the zip code of the youth that are being referred to us, and you can see that Urbana, out of a total of 368 youth so far, approximately 80 or 90 of them came from Urbana or surrounding, right in Urbana district. Then you can get some demographic information about the kids. We have had kids as young as 9, and obviously we go up through age 18, so kids that are 17. Over 18, they are not eligible for services. They go into adult services at that point. You can see the referral sources, which are Champaign Police Department, Urbana Police Department. So of the 80 Urbana kids that had Urbana zip codes, 45 of them were referred to us by the Urbana Police Department. The other ones came from either the school district, agencies, possibly they were picked up in Champaign but were Urbana residents. So you can get a little better picture of things. We try to collect data both ways. We've tried to collect for our own selves the arrest time so that we can see when kids are being arrested. The center is actually open extended hours, so in addition to the regular work week, we're open in the evenings and on Saturday. Right now until midnight. We're considering whether those hours are useful or not, if we need to expand or not do so many hours. We don't have as many walk-ins during some hours as others, but we do follow up on all kids that are referred regardless of whether the police bring them to the center or whether they give us the name and we follow up later. So on the right-hand column are the various different programs that we have MOUs with that we're referring to the kids for services, and then kids that are referred by the police are also being evaluated for whether they need to be on a station adjustment, which is basically a court diversion type arrangement where if they complete a mediation or a peer court agreement, they will not be charged with the crime. So if you have questions, I'd be happy to answer those. We are doing a pre and post screening on all the kids when they come in for risk. And that would be risk with regard to police contact, but also risk with regard to family issues or other things like that, substance abuse, those kind of things, which is why we know where to refer them. And then we're trying to do also the same risk assessment when they leave the program. And you can see from the bottom right corner that the risks are going down from the pre and post tests or pre and post screenings. Not really a test, it's a screening tool. And we do follow up all the kids that are actually referred by the police for 4 to 6 months and check them at least a year later to see if they've had further police contact.
Diane.
What's your overall budget for the YAC?
The overall budget you should potentially have in your application. It's about almost $300 and some $1,000. Regional Planning Commission puts in about $50,000 of that from other resources. The Mental Health Board puts in about $260,000 of that, and then we get our other money from Champaign, Urbana, Rantoul. There's a grant from the state called the Illinois Justice Authority. Those are places that we get other small amounts of funding.
How much does Champaign put in?
Currently, this year, Champaign put in $15,000.
How much did you get from the Mental Health Board, did you say?
Mental Health Board is our largest contributor, and we apply every year through the Mental Health Board funding, and they are focused on youth services and have been for the last couple of years, so the amount has increased. The amount comes from the quarter-cent money for from the county taxes, and we get about 260, I believe it's 266,000 from that,
Oh.
which is the majority of the budget.
Oh, I thought you said the whole budget was 200,000.
No, the whole budget is about almost 300 and
300,000,
320,
and then-
yeah, 320 or 25,000. Yeah, it
Okay,
depends
so
on
then
how
you
much
get
it depends how much we need the
50,000
regional
from
plan.
RPC and 260,000 from the
Yes.
Mental Health Board?
Yes.
And
Do you guys
15
have the total budget in your application? I think
Yeah,
you do.
okay.
Yeah.
But
Yeah,
hard
that's
to keep track of all these things. Okay, any other questions? Diane?
So you would say this is a program aimed at keeping kids out of the criminal justice system?
correct.
Okay.
Eric?
Do you have a measure or a metric of success? And if you do, how are you doing?
We do have a measure of success. We take a look at the kids that are brought in, and we, in the middle, you can see status. In the very middle column, it says status. Of the kids that are brought in, the ones that complete successfully, out of the number of 368 so far that have completed this year are about 39 actually. There are 170 that were assessed, so some of those are still in progress. We do follow the kids for 4 to 6 months, so we're still in progress with those kids. Overall, the program for court diversion itself, which is just the police arrested kids, approximately half succeed, and about half either don't engage at all or drop out at some point and don't complete their agreements or have further contact with the police within a year. We're getting the new kids, about 80 to 100 of these kids that you're seeing here are kids that were referred not from the police, and so we don't have really a baseline statistic yet for them.
Okay, any other questions? Thank you very much.
Thank you.
Next, Presence Covenant Medical Center with the Urbana Community Mobile Dental Clinic.
Good evening. My name is Kevin Kegley. I'm a system grant writer for Presence Health.
My name is Sherry Irvin. I'm the Community Benefit Coordinator for Presence Covenant Medical Center.
And my name is Paul Donahue. I'm the Vice President of our foundation at Presence Covenant.
What we're proposing is to increase services through an existing program at Covenant, in which we provide mobile dental clinics throughout the community and the county at no charge to the qualifying patients. So what we're proposing to do is to expand this to include Urbana residents. We're proposing 6 mobile clinics in collaboration with the Housing Authority of Champaign County and Smile Healthy. Each mobile clinic can serve about 20 patients a day, if we're estimating, based on our previous experience. We're looking at doing 6 of those, so we could serve up to about 120 patients. And we also carved out 20 of those cases for dentures, because that seems to be a big need in the adult dental clinic program that we've experienced in the past. So additionally, let's see, we normally do, I think, what is it, Sherry, 12? Or we do 12 a year.
We did 12 mobile dental clinics last year, and what we found is that we also needed to branch out into the Rantoul market, which we did 3 more additional mobile dental clinics in conjunction with Smile Healthy.
Those are funded through a restricted account of the foundation. So any expansion to what we need or what the need is in the community, we need to find additional resources for. All of the patients that we'll be seeing through the services that are proposed here will be pre-screened to make sure they meet the residency requirement by the Housing Authority. It'll be held on site at the Housing Authority, the Oscar Steer Public Housing Development in Urbana. And I think a wide range of services, of dental services, will be provided with any necessary follow-up services to be provided by Smile Healthy at their facility in conjunction with Francis Nelson. The amount we're applying for is about $26,800, and it's for dental supplies. I believe we've got a daily cost, or each time we put one of these mobile clinics on, there's a fixed price of about $1,800 for us to provide one of those each time. So we're looking at that, plus the $500 per set of dentures for 20 sets, and that comprises our budget.
Okay, any questions, Bill Brown?
Yeah, besides infection, what other kinds of general health problems can people experience if they don't get needed dental care?
Anybody else want to take that? But I can say one reason why we focus on these dental clinics is because a lot of people do show up at our emergency department that don't have any kind of routine maintenance or preventative care. So, like you say, there's infections that can set in, and they end up with a trip to the ER. And since we are focusing on the uninsured, what we're also going to be doing is trying to refer them to sources that could provide medical care beyond just dental services that we're providing. So, I mean, we're trying to provide maybe a medical home for them if they don't have one already, which if they're uninsured, they probably do not, and just provide a little bit better source of routine maintenance, really, and wellness.
Eric?
Could you explain a little bit more fully the nature of the financial stricture? You said that this comes from a fund that's restricted. So what is the source of the fund, and what is the nature of the constraint on the size of the fund?
I'll let Mr. Donahue.
Well, there's really two sources of funding. The first is community benefit, which is the program over which Sherry administers, and there's a budget that she manages that she makes her own judgments as to where to allocate resources in support of community benefit programs, one of which is dental. And so there's fixed resources within Sherry's area of responsibility, so she can manage whatever programs she thinks are appropriate, one of which is dental, but there's a cap. Foundation also has a restricted fund, our Kirby Fund, named after Sister Elizabeth Kirby, whose Compassion for the Poor was used to help raise funds in a set-aside endowment fund for the purpose of helping pay for the indigent care of the poor. And so out of the Kirby Fund in the foundation, we partner with the High School of St. Thomas More to raise money to pay for one mobile dental clinic through the foundation. So those are really the two buckets, one in the community benefit program over which Sherry administers, one in the foundation with restricted assets to pay for mobile dental clinics.
If I could ask a follow-up question, how does what is the process whereby the more central administration in Presence Covenant decides on the size of the community elements budget?
I'm not sure if you could clarify that, sir.
Sure.
Community elements.
Sure. So if I'm using the terminology right, or community benefits. I'm sorry, community benefits. My aging brain sometimes uses the wrong word. The Community Benefits Fund.
I'll have Sherry speak to how her budget is determined.
In our partnership with Smile Healthy, they have identified that it's about $1,500 for each mobile dental clinic that we've done.
Yeah.
So we have partnered with them to do 12 a year. And again, we did branch out last year to do 3 in the Rantoul market. Unfortunately, the need is beyond our resources. So that is why we are trying to get more monies to do more of the dental clinics. As Paul mentioned and Kevin, what we tend to see is folks using RED because they do not have a dentist, a primary home, a dental home. So when they come to us, we certainly will treat them, but we know that that's really not the proper place to receive dental care. We have a great partnership with Smile Healthy in our ED dental referral program. So once they're identified with a dental need, again, we will treat them, but then we will also set them up with Smile Healthy. They will actually go to Smile Healthy. They will receive dental education. So we're not just treating them, we're talking them about preventative measures. We're also giving them supplies, and then they will actually leave with an appointment at our mobile dental clinic.
No, but I'm sorry, I think that was, maybe I didn't make myself clear. How is the overall budget for the community benefits program decided? How is that amount arrived at?
Through our senior leadership team. Basically what we do is we look at the needs of the community and we do a needs assessment, and based off the needs that we see, then we look at what we have in our community benefit budget and how we would be able to try to address those needs.
Yeah, no, I'm trying to probe deeper. How does the community, size of the community benefits budget decided?
I think they look at services that they provide, and they fund those at a certain level each year. But then anything over and above that is through grants and other outside applications for funding sources.
Okay.
Does that answer your question?
Not really, but that's as far as I think I'm going to, that's as much information as I think I will receive.
Well, we do seek a lot.
You know, just to clarify, it's a budgeting process. You know, we're an organization just like the city council.
Sure.
The city of Urbana every year goes through line item by line item and where our scarce resource is going to be allocated this year. Some years it's for streets and sanitations. Other years we need more police on the street. Hospital is no different. We go through every department within that hospital budget and say, where can we allocate resources? The fact of the matter is, even investing dollars in community benefit is becoming more and more difficult because of the cost of care and our challenges in running a hospital. So we're gratified to be able to have resources within our community benefit program, but it's just every year. It's a process that you go through yourself with the city council. Where do we allocate dollars?
Okay, so you're essentially, you do the same thing that we do.
Of course,
Okay.
absolutely.
Okay.
Okay. Carol Ammons?
I just wanted to ask just two small questions. This program is not new, correct? How old is this program?
The hospital has been administering mobile dental clinics for about 5 years ourselves. I cannot speak to how long Smile Healthy has been offering the program in the community.
And the services are also free to the folks that come, and they would have to meet some kind of income eligibility, something?
Not for the programs that the hospital partners with. These are programs that we pay for through help with other funders, but we set up the clinic with Smile Healthy, and the folks that register for the clinic are seen free of charge.
This particular aspect, or this particular proposal, is going to be focusing on the uninsured.
This is just uninsured?
Yes.
Okay. Thank you.
Any other questions? Diane?
Just so I understand, so you are not verifying income eligibility for this program, even if someone is uninsured?
We anticipate most of the applicants to be coming from the Housing Authority. They'll be doing the pre-screening.
So they do come through the, okay.
Yeah.
Do they
So
live in
they'll-
Steer Place, if you're locating it at Steer Place?
Probably, yeah. I would say it's not a requirement for this particular, but I mean, we're looking to focus on Urbana residents and address those needs of those.
So you'd expect the majority to come from Steer Place?
Yeah, I think so. There is a waiting list that Smile Healthy has, and of course we'd have to go down and screen some of those if there's money left over from the Oscar Steer residents, then we would look at them, all the Urbana residents on the current waiting list.
Okay, Carol has another
That's
comment?
okay. He just clarified
Okay.
how he would. Yeah.
Thank you very much.
Thank you.
Next, races with the RAD Kids Personal Safety and Education.
My name is Lisa Perry. I am a child assault prevention educator at Rape Advocacy Counseling and Education Services located at 145A Lincoln Square. Tonight I will just be asking for you to think about increasing our funds so that we can grow a program that we just started in January. The information that's coming around is just the information at a glance, so you can look at that. Basically, this personal empowerment safety program would be available to all students in Urbana eventually, but we are targeting 7 classes. We'd like to get in at least 1 class to each of the elementary schools. The program is open for 3-year-olds to 13-year-olds. We have instructors that are trained already, but we are also in July going to have another instructor training that we would hope that some of the district employees would get on board as well. We already have a few signed up. Currently we are at Yankee Ridge in the after-school program. We finished a class at Leal recently with the University Police Department as well. So the funding for us would be basically in printing supplies. Each family gets a family manual that would help with the education of the whole family. So the student that's in the program goes home with the family manual, so the cost would help defray the cost for us. There's also a certificate that the student gets to keep then with their photo and a fingerprint, and that is something that they can carry with them. Our program is run for free, but not all Rad Kid programs are for free. So if they take that piece of paper to any other Rad Kid program throughout the nation, if it's a $100 program, they can take that piece of paper and know that they came from Urbana, and they can revisit the skills. Of course, 3-year-olds learn differently than a 10-year-old, so each year they can come back and do those safety techniques over and over. Their families are part of that plan as well. So again, it's very, in my eyes, very simple. We need just some monies to help defray the cost of printing, and then to support the staff a little bit so that we can get another staff person on board as well.
Okay, any questions? Eric?
So in your instructor certification program, what are the prerequisites for coming into that program? I mean, basically you can be a layperson, you just want to help.
Absolutely.
Yeah.
Our program is in July, and it would be anybody who would want to help empower students. So there is a background check. They would be under the umbrella. We're using the Penn State money to help pay for this, so that the cost there also, if anybody would be interested in this particular training, would be covered. And then a requirement of doing 2 classes to be able to come and teach 2 classes. But yes, it could be parents, it could be church affiliated people, anybody in our community that would like to be able to teach safety empowerment to students.
Any other questions? Thank you very much.
Well, thank you for your time.
Were you also going to talk about the other, didn't you submit 2 grant applications? Did you talk about the?
No, this one just is.
I only have this one that I know of.
It was only the one. The other program is a program that has been funded in the past. It wasn't one of the new ones.
Oh, it wasn't a new one. Okay, thanks.
Are we good, though? Is that okay?
Yeah.
All right, yeah.
Okay.
All right, any other questions then?
That's
all
it.
right,
Thank you
all.
very much. Regional Office of Education?
I don't see any.
Is there anyone here from the Regional Office of Education? Guess not. Well, I see someone here from the YMCA.
Good evening. My name is Mike Doyle. I'm Executive Director of the University YMCA. We're located at 1001 South Wright Street in Champaign. And I want to start tonight by thanking the city and the township for your support for the past 10 years for our vis-a-vis tutoring program that the University Y has run for several decades now. And as you probably know from reading the proposal, we're seeking to transition your support this year from the specific vis-a-vis tutoring program to a broader Latino justice program that we've been working on the last few years. Over the past 4 years, the University Y has played an important role in the development of a support system for the growing Latino population in our community. During this time, we've initiated several projects to serve Spanish-speaking communities in our area. And in the past year, we've combined those projects into the Latino Justice Program for which we are seeking your support. There's 4 major initiatives that fall under this. The first is the Latina Mentoring Program that we operate out of Urbana High School. It's been operating for the last couple of years, and it works to pair U of I Latino students with Urbana High School students, providing them someone to look up to, someone to encourage them in school, provide them a pathway to see a brighter future in higher education. Second one is the La Línea, which is a Spanish language helpline where Spanish-speaking residents can call and get help with case management, information referral, as well as translation and interpretation services. We sought support for this from you a couple of years ago, and I pulled out the proposal, and at the time I think we had served 22 people. That has climbed up to 65 this past year in 2013, and already in the first quarter of 2014 we've served over 30 families. So we're seeing a dramatic increase as people learn more about the service and turn to us for assistance. The third program is the vis-a-vis tutoring program, which you've supported in the past. But one of the things that we're moving toward this year is trying to assist teachers who are looking for Spanish-speaking tutors, which is a real need in the local schools. And so they're working with several classes at the university, recruiting Spanish-speaking students to provide more tutors who can help those Spanish-speaking students in the schools. And then the final initiative that we'll be starting this summer is a new paid internship program for Latino youth in our community. What we'll be working on this year is people may know a couple of years ago President Obama set up the DACA program, which is Deferred Action for Childhood Arrivals for Dreamers. Those young people could apply for being protected from deportation if they had been here for a certain number of years and were brought here when they were young children. Their applications, if approved, only lasted 2 years. So this summer we're going to see a huge number of local youth who will be looking to reapply into the DACA program. And we're already hearing problems and some concerns of families. Part of that, if students had not been in school, they had to go into a GED program or some other kind of educational program to be able to be eligible. Some of those students have now dropped out of those programs and are looking at losing their DACA eligibility. So we're working right now to set up a community meeting at Urbana High School later this summer for those youth. And this is part of that initiative, is to do outreach into the community using our local Latino youth to do some of that outreach. We're seeking your support for the combination of services here in a particularly difficult period for the University Y. As some of you know, the Catholic Church withdrew a $60,000 grant from the program, and we're struggling to avoid cutting back on services at a time when the demand is higher than ever. And I look forward to any questions you might have.
Thanks. Any questions for Mike? Dennis.
So what you're interested in doing is specifically to provide information to the Latino community about how they can reapply for this, the DACA
program. That's one piece of it for the youth who need to reapply for that.
Okay, and that's really what you're hoping to achieve this summer in the workshops?
Under the DACA program and that initiative, yes. But so, for example, on the La Línea program, which is an ongoing program that we have where it's a number where people call and get help speaking Spanish. In fact, we were getting so many calls last fall that we actually had to shut it down during the fall, which lowered some of the numbers. And we worked out an arrangement with the Latino Partnership in town, and they are now currently funding a part-time intake worker to help us manage the cases and the calls that we're getting in. So this project would also support the La Línea. We've been fortunate enough right now to have a MSW master's in social work who is serving as the case manager for that in those cases. And we've had some resources from Latino Partnership to be able to have an intake worker. So we're really just trying to bolster these services. Right now, all of the advocacy that those families receive are from volunteers who go through a training, and they get assistance, whether that's housing, healthcare. We do translation at local social service agencies and are getting calls regularly for assistance for that. So that's just another piece of that. So I would say the DACA would be a focus this summer, but all these things are happening at once.
So just to kind of sort out what you were just describing, the La Nina
Right.
program, that's an ongoing program that you've already established.
Right.
So
it's
what
been
we're
running for about 2 years now.
Right. So what we're looking at is this request is for the new program. That's why you're discussing it today, right, with us?
Well,
The
what we're
Latino
asking for you
Justice
is,
program?
I would say we're asking support for, largely if you look at the budget, is for staff support to be able to manage all of these various programs at once.
Eric?
But I think one of the things that should be clarified is that you're not only looking to do some new things where the need has emerged, but you're looking to fill a budget hole just to keep doing what you've been doing.
Yeah, and you know, to date we've raised a little over. I looked earlier today. We've raised over $40,400 of the $60,000 that we lost in the last 7 months. So we've received incredible support from the community in terms of doing that. But being able to go forward and maintain those services is a bit difficult.
Do you care to share why you lost the support? What was the stand you took that did that, or if you don't want to, that's fine. But I think it was very admirable. So I'd like my colleagues to hear.
At the time, you know, we have received a grant from the Catholic Church for $37,000 last fiscal year. This year's grant was going to increase to $60,000, but when we received the contract from them, there was a stipulation that we had to no longer be affiliated with the Illinois Coalition for Immigrants and Refugee Rights, which is the statewide group that we work with on all these programs. And the reason was that they had endorsed marriage equality in the state of Illinois. And the Catholic Church was going to support any organization that was affiliated with an organization that had taken that position. So our board decided, although it was going to have a dramatic impact on our ability to sustain these services, that we didn't feel a funder should be in a position of saying who we could or couldn't associate with. And also, as an organization, we've always been very open to all aspects of our community and didn't feel like that kind of an attitude was appropriate for our organization. So our board, to their credit, decided to move forward without the funding, and we haven't cut back on the services. Again, we're sort of going hand to mouth to get through this year. We're hopeful to get it. We're looking at next year's budget, and so this will be helpful for that.
Carol?
The Spanish helpline is, I know that's not the name of it, but since you described it that way, also helps other portions of our community. Can you expound a little bit on who actually calls and who receives assistance from the helpline?
Sure. I mean, it's largely, it's a Spanish speaking, so the operator, the people who answer the phone, the people who talk to clients are Spanish speakers. One of the things that we find with a lot of people are just intimidated from going to agencies. Agencies, as hard as they work to have someone to speak someone's language, aren't often able to do it. So it's largely focused on Spanish-speaking populations. We do have people who we assist beyond that, who call up and get the number from someone in their family who might be doing it. But the kinds of cases that we're getting are oftentimes people who have fallen through the cracks. We have people who are dealing with issues with landlords, so then we'll work with the tenant union on that. We've had cases. There was just recently a case where a young woman, her child was in the Champaign schools. I know this is an Urbana issue, but where the child was being disciplined and had been picked on because they didn't speak English very well and was being disciplined by the school. And so our advocate went with the family and attended the meeting with them, was able to translate for them. So wherever possible, we try and help alleviate some of the pressures that people are facing. We've been called by the hospitals and clinics to help do some translations for that. So it's pretty wide-ranging. I think the only thing that is probably unique about it is these are people who are new to our community and new to the services and often don't know where to go. Part of the agreement with Latino Partnership is that when 211 was being set up here in Champaign County this past year, there was no ability, you know, they'll translate for you and tell you where to go, but there's no one who you can work with where you're guaranteed to speak Spanish. So the reason Latino Partnership stood up and are contributing, I believe it's $400 a month toward that intake worker salary, was a way so when people call, they can see Latino Partnership, immigration, CU immigration form, or the La Línea as a way to refer them for services. So we are the contact on 211 for that.
Anyone else? Thank you very much.
Thanks a lot. Appreciate it.
Did anyone come from the Regional Office of Education? Apparently not. Okay, anyone have any comments? Did you want to say something?
I just think we have hard choices. I mean, the things that we've heard are really worthwhile. And so I hope we have wisdom to match that.
Did you want to say something?
I just wanted to ask Janelle if she could explain the rest of the process in case regional office couldn't make it or some other agencies we need to hear from.
As you review the information in your packets with all the applications, if there are additional agencies that you would like to hear from or would like more information on, we can certainly ask them to come and present before you. If there are questions that you all may have about a particular application or applicant, please send them to me and I can get that additional information from the agency. But usually as it goes, there is a sheet where you all can fill out your selections. I might need a little guidance, but I think you put the dollar amount that you would recommend for that agency, and it is a minimum of 4 votes from or 4 dollar amount.
What in the past we have worked with a total dollar constraint, and of course we don't have we haven't actually at this point decided on that dollar constraint. So I think one of the things that we have to decide, I mean, what we could do, I suppose, is people could fill in and say, yeah, I think this fraction of the total should go here, or this fraction of the total should go here, or they can fill it in based on an assumption that this year's total dollars, will be the same as last year's dollars, and then if that turns out not to be the case as we go through the budgeting process, we'd have to do an adjustment afterwards. And I didn't hear anybody else volunteering to, do the final juggling of the numbers to replace either Charlie or me, although I think either one of us is probably open to volunteers, but unless you think we were like totally so obnoxious you'd rather do it yourself. And I can't speak for Charlie, but I assume that he's also willing to. Charlie will help me if I'm going to do it again. Okay, so we'll get that done. But I think the council as a whole, I think we need to decide on how, in the guidance for how we'll fill it out. I would suggest the following. I would suggest filling out the dollars in such a way that you make the total dollars be the same as last year's. And then we can adjust later if that turns out not to be the case.
That's about 300,000, but you see that the requests this year add up to over 500,000. So, and we don't even know if we can come up with the 300,000, but I think that your suggestion is what we did last year, and it makes sense. Yeah. We really can't go beyond what we did last year, and there's a real question of whether we can even do what we did last year.
Yeah. But in the absence of more
for a working hypothesis, and then
working hypothesis, yeah,
you could just sort of whatever numbers we come up with, we could use those percentages for the final.
Right.
When we come up with a final total.
Right.
Before we close, I'd like to ask if there's anyone in the audience that would like to comment or has a question. We have public input at this point. No one? Okay. There being no further business, we will adjourn this meeting, and it will be followed at 7 o'clock by a meeting of the Committee of the Whole of the Urbana City Council, chaired by Diane Marlin.